Housekeeping. I'm Aaron Levo, the Vice President of People, Culture, and Communications. Happy to be here moderating today's HHS Town Hall on September 7th. If you can believe it, it's September 7th, and here we are together. We have a really packed agenda today. There's lots of important information to share. As I said a moment ago, the session will be recorded, so if you know colleagues that couldn't be here today to view this live, you could encourage them to view it after the fact. It'll be shared on the hub and otherwise throughout the organization once we're done. I'll just remind everyone we do have the opportunity for questions today. Please use the Q&A function to pose questions at the bottom of your screen, and our presenters and subject matter experts will answer your questions as we go. If there's any left at the end, we'll be sure to send you a response. So please include your name so we can make sure we get an answer to you. And we'll keep the Q&A function for questions. We'll reserve the chat function for our celebrations, which is our custom at the end of all of our presentations. So as we go, for sure, think about your questions, but also think about anything you'd like to remark upon, shout out, celebrations, accomplishments that you'd like to make noted today. And we'll do our best to leave as much time as possible for that at the end of today's town hall. So I think that's it for me in terms of housekeeping. So I'll ask our President and CEO, Rob McIsaac, to kick things off formally. So Rob, over to you.
Thanks very much, Aaron, and good morning, everybody. Thanks for joining today's town hall. As is our tradition, I'm going to start by acknowledging that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. I want to note in this regard that September 30 is Orange Shirt Day and National Day for Truth and Reconciliation. So this is a day to recognize the legacy of the residential school system in Canada and to reaffirm our collective commitment to reconciliation. As a hospital, we acknowledge that Indigenous peoples can experience racism, discrimination, and culturally unsafe care within healthcare settings, and that we all have an obligation to eliminate barriers to safe, culturally sensitive care. So our colleague, Ramon Sidhu, Human Rights and Inclusion Associate, is going to provide an update on Orange Shirt Day events and resources later in today's agenda. As always, I would encourage you to take a moment to review what's available and to reflect on the role that we can play in reconciliation, both as Canadians and as healthcare providers. You can also read HHS's 5-year Equity, Diversity, and Inclusion Plan on the Hub, which outlines the concrete steps HHS is taking to advance EDI at our hospital, both now and in the coming years. So it's so good to see all of you here and to be back to a town hall after a summer break. I really hope that you've had the opportunity to step away from work and spend some time with friends and family this summer. I know it's been a busy summer at HHS as our hospitals, along with our peers across the province, continue to face high patient volumes at the same time as we struggle with staffing challenges. We do have a number of corporate projects and initiatives underway, which are aimed at mitigating the impacts of these issues. And I think it's fair to say that the people doing that work have made some good progress over the past summer months. As we head into what is predicted to be another severe respiratory illness season, and we'll hear more about that, our sites are ramping up planning to further ensure that we can protect our hospital's resources for the people who need them most. You're going to hear updates about hospital operations and capacity both today and in the weeks to come. So I'm going to leave my remarks there and very pleased to turn it over to Sharon Pearson, who is going to provide an update on hospital operations. Sharon, over to you.
Great. Thank you, Rob. And happy September to everyone. It is hard to believe that the summer has passed us by. Happy to be here to provide an update on operations. So if we could just go to the next slide, please. In terms of a COVID update, starting from where we left off at our last town hall, our current COVID numbers are 25, less than 5 in the ICU, and we do have 2 active outbreaks currently. We do have Dr. Mertz with us today, who's going to provide us a more in-depth overview of what we can anticipate this coming fall with respect to some of the issues related to COVID and other variants. Next slide, please. In terms of our occupancy, as Rob said, we have had a very busy summer, have not seen a substantive drop in our occupancy throughout the summer. You'll note a bit lower occupancy in our ICUs, but at a site-wide vantage, certainly our occupancy has been well above 100, with the JH being the most pressured site and sustaining that pressure, unfortunately, throughout July, August, and September. From an ALC perspective, we continue to maintain ALC volumes anywhere between 230 to 260. If you'll recall from previous updates, we had reached a low of 150, but we have seen those numbers climb steadily throughout the recent months. Unfortunately, we still have capacity pressures within our community and certainly health human resource pressures as well. On to the next slide, please. In terms of our pre-COVID surgical activity, I was updating that we were in the range of 80 to 85 most of the springtime. Right now, we're sitting at 90%, and we do hope to be exceeding 100% by the fall. Much of that can be attributed to some stabilization of human resource, certainly a number of new anesthetists that will be joining HHS, which is great news. Along with the orientation of a number of new operating nurses as well. There's intense focus on our long wait surgical cases, both locally within HHS, but certainly within our sub-region and across the province, and a number of strategies in place to address those long wait cases. Lots of innovative strategies in play as well. We continue to work with our partner at St. Joe's in terms of the regional peri-op capacity that they have. And using that capacity to offset some of our volumes at HHS. In terms of trauma, we've seen similar volumes this May to August that we have seen in previous, the last 2 previous years. Next slide, please. Our ED trends, you can see relatively flat. The blue line is our adult volumes, June, July, and August. Bit of a decline in the summer months for our pediatric cases, which is not atypical. And certainly we would anticipate that we'll see an increase in those volumes when we look at September data and certainly going into the fall. And next slide. This is a great news story. You can see the summer of 2022, our ambulance offload time in minutes was 207. That's an aggregate measure across our sites. And this summer is 46 minutes. So we have sustained those gains we made in reducing our offload time. So huge thank you to the teams. There's been a lot of effort and focus. And certainly the capacity that we were able to add at the Juravinski site to assist with offload processes has really contributed to the reductions that we've seen. So really good news story there. Next slide, please. In terms of the workforce planning, as Rob indicated, there has been a lot of work underway to stabilize our workforce and really focus on our retention strategies. We've talked in the past about the centralized recruitment model, and certainly that continues to be a very successful model for us in terms of really assisting with more rapid intake of new applicants into HHS. Certainly looking at leveraging a lot of opportunities through the province, the new grad guarantee, there's new programs with clinical scholar programs. We've introduced our own clinical resource nursing roles across many areas in the organization as well. Certainly expansion of the internationally educated nursing role as well. We're always looking for opportunities and how we can assist with those looking to come to HHS. Lots of conversation about could we support in a different way residency for those that are coming to HHS or looking to come to HHS from across the globe. So those conversations are in progress. We've refreshed our local and our corporate orientation programs, continue to look at how we can build stronger programs and certainly make staff feel welcome to HHS. On to the next slide, please. There was a call for proposals just this past August, July, looking for new models of care. Provincial call, HHS submitted 17 proposals across a spectrum of initiatives from the various sites. The maximum amount allotted is $2 million for a project. So some of these can be quite substantive projects. You can see the criteria in terms of what the projects needed to be able to deliver on, and each of our projects did that. So we are very hopeful that we will be successful with at least a few of those projects. So we'll update you as we hear more back. And next slide. Just a reminder, we talked a little bit about this previously, but more than a significant investment in the McMaster Children's Hospital from the province to all of the Children's Hospital. Provided here a little bit of detail in terms of the funding that has come in to the organization to help us expand existing program primarily. You can see the $3.9 million for critical care beds. The development of those 4 new beds is currently underway for PICU, and hope to have those open soon. But certainly a spectrum of other services that will benefit from the pediatric funds that are coming in. It does mean a significant expansion in both physician and clinical resources, as well as a need to look at capacity at that site too. So lots more to come on the outputs of all of the resources that are coming into the organization. And then lastly, certainly a huge thank you, if you go to the next slide, to everyone. It has been a very busy summer. It has been incredibly challenging with our HHR pressures. So I do thank everyone for continuing to serve our patients as we do. So thanks very much, and I will hand it back to Aaron.
Yeah, thanks very much for the update, Sharon. Okay, so keeping things moving in our agenda. Next, I'd like to introduce Raman Sidhu. Raman's a Human Rights and Inclusion Associate at HHS, and she's here to talk to us. Rob mentioned off the top, September 30th is Orange Shirt Day and National Day for Truth and Reconciliation. Raman, what do we need to know?
Thank you. Thanks, Aaron. Thank you, Rob, for the introductions as well. As we know that September 30th marks a very significant day, and it marks as Orange Shirt and the second National Day for Truth and Reconciliation. Orange Shirt Day, named for the story of residential school survivor Phyllis Jack Webstack, remembers and honors the Indigenous children forced into residential schools. Thank you. National Day for Truth and Reconciliation is recognized by Canada as a statutory holiday since 2021, and this day honors survivors, their families, and communities who experienced injustice and trauma. Next slide, please. A couple of things that you can look up to from our department for this month. We have 2 film screenings coming up for September 26th and September 28th. They're half an hour long, and they will be on Zoom. For registrations, you can use the email provided. Also, we do have Orange Shirt cookies that will be at all cafeterias. They will be up for sale, and the proceeds will go to HHS Indigenous Outreach Programs. And I've heard they sell out pretty quick, so please get them before they sell out. You're invited also to participate in Orange Shirt Day by wearing orange on September 28th, 29th, and 30th, and reflect on the truth about residential schools and the path moving forward to healing. Next slide, please. A major step yesterday was taken towards truth and reconciliation as a joint effort by our organization. It was an initiative to secure Every Child Matters flag for all of our sites. And at Jurbanski Hospital yesterday, with the collaboration of Equity, Diversity, Inclusion, and Human Rights team, Communications team, and Regional Cancer Program team, a smudging ceremony was performed for the flag, and we're sharing a couple of photos from the ceremony with you. In this picture, in the first picture, you can see Indigenous elder and knowledge keeper grandmother Mary Jones, who led the smudging ceremony with support of her helper Shannon Mitchell. And in the coming few weeks, you will also be able to see Every Child Matters flag in our hallways next to the pride flags. The impact of residential schools has been far-reaching, and Every Child Matters carries a profound message and is a tribute to innocent lives that were lost. I urge and request folks to take the time to learn about the flag and the value it holds to our Indigenous communities. And let's not forget that families are still suffering from the trauma endured historically, and let's make it a collective responsibility to acknowledge and understand the meaning of the day. Last but not the least, Pat Mandy Inclusion Award nominations are now open, and it's a gentle reminder for everyone to please nominate your colleagues, and I encourage folks to nominate their fellow employees, their leaders, students, and volunteers who you think have inspired you with their commitment towards equity, diversity, and inclusion. And you can check out EDI Human Rights Hub page events section for all the details in appropriate form and resources for Indigenous History Month as well. Thank you.
Amazing. Thanks very much, Raman. And absolutely would encourage everyone to visit the Hub page that was noted. Every year, there's an incredible wealth of resources for learning related to September 30th, and certainly many other opportunities for personal growth available to investigate through those resources available on the Hub. Next up on our agenda today, we have Dr. Dominic Mertz, who's our Medical Director for Infection Prevention and Control. Dominic will give us an update as to where things sit in terms of respiratory virus season and what we can expect. So Dominic, over to you.
Yeah, thank you, Aaron. Next slide, please. I was given these three topics, and the first two I can address with some level of certainty, which is the current COVID-19 activity and the subvariants, and other respiratory virus activity, where there's simply only uncertainty at this point is what to expect in the upcoming respiratory virus season. But I will show you some data from Australia, which may give us a clue. And what we know, however, is what we can expect in terms of vaccines. Next slide. So first looking back, what happened over the last few weeks, and this is again COVID focused. You can see the highlighted area, which are the last 5 weeks, and you see we did see an increase in COVID positive patients in hospital in those weeks 32 to 36 as compared to where we've been in July and June and July. We are still lower yet than we've been around the same time in 2022, where we had that sort of first peak over the summer months. Then it came back again, and then by the end of September started to increase again to that second peak. Next slide. Certainly that higher activity of COVID has an impact on outbreaks as well. These are provincial outbreak numbers. Red are acute care hospitals. As usual, most of the outbreaks are happening in long-term care and retirement homes, followed by the hospitals, and you see that increase over the last 2 weeks. Next slide. When you compare it to where we've been in summer last year, however, the picture looks much, much better. And yes, we have had COVID outbreaks in August. They have been declared over at this point of time in the city of Hamilton. There's 5 respiratory virus outbreaks, 4 are COVID, and 1 is rhinovirus. We currently only have ARO outbreaks that we are dealing with. Next slide. The Omicron variant soup, and I'm hesitant to show any of this, to be honest, but given how much focus in the media still is around those new lineages and sub-lineages, I felt like, okay, I will share a couple slides on this. Basically, it's a soup. You see a lot of different sub-lineages here represented. The ones that are most common currently are EG51, 511, and XBB 1.16. Different picture than what you see at the very left-hand side, summer last year, where we had one lineage, BA5, being responsible for roughly 90% of COVID patients. So we currently don't have one single predominant strain that's sort of spreading through the province. It's a mix of many, many, as you can see here. Next slide. And then you can calculate what's the growth versus the decrease in proportion of those different lineages. The ones I highlighted here in yellow are the ones that are currently increasing, that have a growth benefit, over the others, and those others include XBB 1.5, which clearly is on the decline at this point of time. And you may remember XBB 1.5, which is the strain that the upcoming vaccine is targeting. Next slide. The new subvariant BA.286, which is the one you probably read about in the media, had been identified in Canada, I believe, last week, in BC for the first time. Many other countries that do regular sequencing identified it as well, so it certainly has internationally spread. It's of interest. It's not a variant of concern at this point because of its many mutations, which improves its ability to escape our immunity that we have in the population from vaccines and previous infection. While we see some growth benefit, and again, it's early days for this subvariant at this point, we don't see explosive growth. And one thing that people ask is, well, there might be more immune escape, but less fitness with this virus, so it may not push through as much as, for example, BA.5 did last summer. Next slide. Broadening the scope beyond COVID, not really much happening as you would expect in a more or less normal summer from a respiratory virus protection perspective. You can see I added that red line there. We are pretty much at similar levels when we are looking at ED visits for respiratory infections over this summer as we've been over last summer. Next slide. Now, the bigger question is, and that's where we see mostly clouds rather than clarity, is what's going to happen going into the next respiratory virus season. Next slide. And as I mentioned, what we tend to do is we look at Australia, which has great surveillance data and gives us a clue of at least what happened there. And then we can sort of guesstimate whether it will look similar or might end up looking very differently here. But just sharing quickly what's been happening in Australia. Red line here being the number of ILIs reported, so febrile respiratory infections through the GP surveillance system, so their families, physicians, what they saw. And you can see a pretty average season that they had over this, well, their winter, our summer so far. Little lower than 2022, significantly lower than some of those severe flu seasons in the past. Next slide. When looking at lab-confirmed flu per se, it was a pretty average season, certainly lower than 2022 and 2017, which were very active flu seasons, but certainly also worse than the 5-year average pre-pandemic. So somewhere in the middle, I guess, when you look back over the last few years. Next slide. Then here, again, people start to like variants and subvariants. Now with flu, we have flu A and flu B, and then we have H1N1 and H3N2 typically among flu A. What this picture shows you, they had more flu B than we would typically have expected this winter. Other than that, it was a predominantly H1N1 season, and we would expect a H1N1 season for us here as well, given that that typically translates quite reliably into what we see. Next slide. RSV, unfortunately, there's not an awful lot of data that I could find. And as you may remember, RSV was the main culprit last year that we had been struggling an awful lot, in particular in our children's population and at the Children's Hospital. I've only found some data with comparison to last year for Western Australia, shows again I would say significant RSV season. The good news is it wasn't as bad as last year, roughly 40% less cases, at least so far. But again, to what extent that will translate into our situation is to be determined. Next slide. What we know for sure in terms of vaccines is that we are waiting for 2 vaccines at this point. One is the influenza annual vaccine, or using COVID terminology, our annual booster. And the COVID monovalent XBB 1.5 vaccine, which is supposed to become available by the end of the month. That's the last date I've seen. Currently available is the bivalent vaccines still, targeting BA1 and BA5, and people are eligible if they had their last booster or last infection more than 6 months ago. Next slide. So in summary, where we are today, COVID is was less active over the summer than same time last year, but it's starting to increase. Other respiratory viruses showed a pretty normal summer, some cases, some outbreak, but nothing out of the ordinary. Australia had, I would say, a more or less normal winter, higher RSV activity though, but lower than 2022. What to expect over our winter? The only thing that I think we can take for granted, we will see an increase in acute respiratory virus infection. We can only not tell you how significant that will be and when this will be peaking, or when the various viruses will be peaking. And again, you don't need a crystal ball to tell you. If you have a hospital system that's already running at more than 100% without a lot of respiratory virus activity, it will affect us, and it will affect us negatively over the next few months. Maybe we see a more normal pattern with first rhinoenterovirus, again, typically peaking sometime in later September. Then we would see typically RSV, and then eventually influenza, which was peaking very early last year. So maybe it's more normal that it will peak in end of December, beginning of January, as we were used to pre-pandemic. Last year, again, RSV and flu peaked around the same time. And COVID will continue to increase. Again, I think that's something we can take for granted. Will we see 1, 2, or 3 peaks as we saw last year? Who knows? Will we see a more significant wave as BA286? Again, it's early days. Most experts, I feel like, are in agreement that's probably not going to happen given what we've seen from this subvariant so far. But again, early days, needs to be determined. Vaccine-wise, waiting for the annual flu shot and XBB 1.5 monovalent COVID vaccine at this point. Handing over back to you, Aaron. Thank you so much.
Okay, thanks very much, Dominic, for the thorough update. Always good to hear and have that input. So wonderful. Next up, we are in the midst of planning for accreditation, I believe, just around the corner. I know I was in at least 2 mock tracers this week already, and I know others have been as well. And to give us an update on the work underway across the organization, we have Tim Dietrich, who's our Interim Vice President of Quality and Performance. Tim, where are we at, and what do we need to know?
Thanks very much, Aaron. Happy to provide an update for the organization. Next slide, please. So we are just over 10 days away from our on-site survey with Accreditation Canada. And I know teams are busy preparing for that survey. Some of the things you should know are laid out on the slide in front of you. I'll obviously call attention to some of the preparation checklists that our accreditation team has put together for units to prepare for the on-site survey. Certainly reviewing the week schedule that's now being firmed up and finalized, making sure that you're connecting with your physician partners so they're aware of who's going to be working the day that the surveyors are going to be on the unit, just so there's clear communication about the date, the time, and what can be expected for the team. We've got an excellent accreditation myths video that might help some nervous team members calm and their approach to the on-site survey. Next slide, please. And what I just want to remind folks is the accreditation is a learning process. We're going to learn about we're going to be able to, celebrate what we do well, and we're going to be able to learn about where we can improve. So this is not an evaluation of staff individually or our leadership specifically. So if you don't know an answer, reach out, ask for help when you need it. And we've got lots of resources available to help you on the next slide, please. So you can see all the different ways you can connect. If you need more resources, the accreditation page on the hub is a great place to start. It's on the left-hand side in the top of the ribbon of the hub page, and you can find all the resources there. So before I wrap up, I think it's important to just take this opportunity to thank all of you, leaders, staff, physicians, for all the hard work that you're doing to help us prepare for the on-site accreditation survey. I know I'm excited for us to share all the things that we do well and also learn where we can improve based on what our surveyors notice about our processes. I do want to specifically call out the amount of activity that's happening. And I know at this time of the cycle, it happens every 4 years, there's a lot of franticness, a lot of people running around, trying to make sure that everything's right for the survey. I just want to acknowledge all that hard work that you're doing. I don't know about you, but for me, I can almost feel this at my core in terms of the anxiety that comes at this time in the accreditation cycle. I just want you to know that we've got, resilience tools, your breathing techniques. Taking a deep breath always helps calm me, and just remind myself, we're doing all the right things. You're doing all the preparations that you can. And it's going to go well. As the last slide says, please flip to it. We've got this. So I have all the confidence in us that we're going to be able to describe what we do so well, and the accreditation team will pick up on that. So again, take a deep breath. We've got this, and I look forward to the survey week. Thank you.
Thanks very much for the update, Tim, and all the work that's gone into accreditation. I think that will be my mantra for the day, for sure. We've got this. It's really great to hear. Next up on our agenda to talk more about the virtual nurse-to-nurse support line is Kara Langdon. Kara is our manager of virtual care. And I know you might have read stories on the Hub about this project, and really great to have Kara here to give us a little bit more insight into it. So over to you.
Great. Thanks so much, Aaron. Okay, so I'll jump right in. Next slide, please. I am very excited to share with you about the virtual nurse-to-nurse support line. This was initially something that was piloted in select units across HHS, and we just recently expanded and opened it up to our HHS adult sites and units. So all HHS adult sites and units now have access to this. So what it is that the program provides an on-call peer registered nurse to connect with for our RNs and RPNs, again, across our adult sites, for any non-urgent questions that might arise during after-hours shifts, so evenings, nights, and weekends. So this might be something that includes non-urgent clinical guidance questions, which tend to be our biggest, our most common set of questions. It could be whether you're unsure if there's an escalation that's needed, helping to prepare for that escalation, help navigating or finding our very many policies and procedures, or even if you want a phone a friend peer resource to talk to from a social and mentorship perspective. So we've received almost 250 calls to date across our sites. And we have a wonderful team of nurses. You may have seen them in some recent share articles where our nurses have had experience across our HHS sites. And the idea is really to give our teams an additional RN resource when we know times are a bit tougher, when shifts might be a bit shorter in terms of working, charge nurses take up patient assignments, educators are no longer available after hours. So really it's meant to be that additional team resource. And we're just trying a new innovative way to connect you with a seasoned registered nurse in a different way. So next slide, please. So our nurses can be reached from 4 p.m. to 7 a.m. Monday to Friday, and 24 hours on Saturdays or Sundays. So it's really meant to be that evening and night shift throughout the week, and then 24 hours on the weekends. And the most common way to get a hold of our team is via phone. Our extension is 41600. That is the most common way that nurses have decided to get a hold of us. You can also get a hold of us through the Epic Secure Chat group function, which is a great way as well that nurses tend to be using. And we also have video chat available if that works in your environment, you want to connect with us that way as well. Next slide, please. And lastly, you'll notice in the next 2 weeks, our team is seeking feedback from nurses about your experience with this program. So whether you've used the program or not used the program, we would love to hear from you. It's a 5-minute survey and you have a chance to win an HHS coffee gift card upon completion of the survey. So you'll see this link come out in the HHS dispatch news, and you also may receive it from your leader if you were one of the initial pilot groups for this. The feedback is so important to us as we evaluate this program, look to continuously improve. And it's also part of a research study as well, given that this program is the first of its kind in Canada. So please feel free to reach out to our team. If you need anything or have any questions, we can be reached at virtualcare@hhsc.ca. So thank you, and I'll pass it back to Aaron.
Yeah, thanks very much, Kara, for that. Okay, next up in our agenda, Susan Pucciarelli is our Director of Health, Safety, and Wellness, and is here to talk to us about a new project underway during Healthy Workplace Month, and as well an exciting project underway called Beyond Silence. So Susan, over to you.
Terrific. Thank you so much, Aaron, and thanks everyone for being here. Next slide, please. Really excited to tell you about what we're doing this year for Healthy Workplace Month. We've got a very exciting calendar of activities for everyone at HHS to participate in, thanks to our Shine Wellness team and our partnership with the YMCA. So for the month of October, staff, physicians, and residents can enjoy a variety of wellness-based classes and workshops, both at our sites, but also at our local YMCA facilities. So again, we've entered into this partnership with the Y, and what they're providing for us for the month of October is free membership for our staff and your families, and all of the different activities that they have available. So that could include family swim, family pickleball, variety of fitness classes, etc. So we will be theming these each week, and you can see here on this slide that we've got the 4 themes for each of the weeks. And each of those weeks has suggested activities designed to support our wellness strategy at HHS. All of this information is going to be available on a calendar of events, which is going to be accessible through the hub. And we're working with the Y on a digital registration platform so that once we launch this, you'll be able to see the instructions. You'll be able to sort either by class or by facility or by site. And whether or not it's an HHS offering or whether or not it's a YMCA offering, that will all be available to you. So really looking forward to this, and we will have ongoing evaluations following each of these activities so that we can gauge how important they are to you and how meaningful and beneficial they have been. Next slide. So in addition to Healthy Workplace Month, which is for the month of October, the timing is just such that we are also able to launch a new program that is called Beyond Silence. So this is a 6-month research study, peer support mobile app, and it's called Beyond Silence. Beyond Silence is a program that has actually been in existence for a number of years, and we at HHS participated in that project back in around 2015, 2016. That evidence-based information on mental health support for healthcare workers has continued to evolve. And now the research team at McMaster University has developed this app, which we have been very fortunate in being able to participate in this research study. So the app is designed to provide early intervention mental health support for frontline Canadian healthcare workers, considering the impact of the COVID-19 pandemic. So during this 6-month study, participants will be able, so everybody at HHS will be able to download the Beyond Silence app, and that will gain you access to private, on-demand, evidence-based mental health information that is customized for healthcare organizations. In addition, there is also access to trained peer support providers. Next slide. So this project is intended to support staff, physician, and resident workplace psychological health and safety and well-being. It's one of the actions that we're taking within our overall corporate wellness strategy that is tied to our strategic plan. Next slide. The research team, which is led by McMaster University Associate Professor, Dr. Sandra Moll, is looking for HHS staff volunteers that are willing to be trained as peer support providers for our organization. Training and ongoing support, including a community of practice, will also be provided. If you're interested, the URL link is here on the screen for you to follow. There is an application form that we ask you to complete if you are interested in becoming a peer support provider. The deadline for the applications is September 15th. There's a lot more information, including an FAQ on the hub. You can also go to the Beyond Silence website directly. And if you're on the hub in the search feature, if you type in Beyond Silence, it will take you to the information directly where we have placed all of the documents related to Beyond Silence. So we hope that this is going to be of great benefit to our staff and physicians and residents in supporting your mental health and mental well-being. So really looking forward to participating in this project. Thank you so much. And Aaron, I'll turn it back over to you.
Okay, thanks very much, Susan, for all of that. I know we've had some questions come in today, and that's very reasonable because we've gone through an incredible wealth of content today. You just think of the breadth of topics covered today. Very great job done by our presenters and tons of pertinent information for our workforce. So I'd encourage all of our viewers today to point to your colleagues the opportunity to view today's town hall online and through the hub. And if you do have additional questions that maybe arise after we're done today, you can always email those to hhsnews@hhsc.ca, and we'll make sure to get an answer to you right away. So next up on our agenda, I think we transition to our celebrations portion of today. So I'd really encourage everyone that I know you've been thinking about the potential celebrations and things you'd like to remark upon, maybe to comment on your colleagues, things that they've done that are exceptional and worth remarking. You can use the chat function to type it in, and I'll read that out. Or you could also raise your hand and we'll call upon you to give your celebration live. So we'll see what we have coming up. Might be a little bit rusty here in keeping up with the chat. Leslie Gillies, you've got a hand up. What would you like to celebrate today?
I just wanted to, indicate sincere appreciation and huge shout out to our facilities and parking colleagues. There was major restorative work that was required in the parking lot at St. Peter's. Everyone worked extremely hard with our partners to get this done over the summer. Completed on time and has never looked so good. So thank you for all that hard work. And I know patients, families, and staff are very appreciative.
That's awesome. Thanks very much. I see one of our attendees has a hand up, Kyle Graham. Kyle, go ahead. What would you like to celebrate today?
Good afternoon, Aaron and everybody. Not to single one person out, but I wanted to celebrate the Child and Youth Mental Health program, specifically the ambulatory services. We were faced with a challenge where our dialectical behavior therapy groups were quite large and our wait list was quite large. And the group came together and came up with an innovative idea around offering a DBT summer camp for patients and families. And that has since been completed. The foundation also supported that with being able to provide some snacks to some of these groups. And it resulted in us eliminating the wait list for that group, as well as accommodating patients and families that otherwise would not have been able to get to it. So a huge shout out to our team here, as well as the foundation for support.
Yeah, thanks very much, Kyle. I'll read out just a couple that are in the chat function here. We have from Kirsten, a quality of care consultant, grateful for the opportunity for staff to partner with the YWCA. Thank you. From Ellen Littman, happy to see so much info for parents to support children going back to school. That's great for sure. Back to school. I know it's busy and everybody's house right now that has back to school ongoing. And there are lots of great resources available that we have put out through HHS and otherwise. All right, well, not seeing any additional hands up, and I know the chat is slowing down. One more here from Monica. Kudos and gratitude to Dina Clout and Stephanie Rowe Jans for their everyday work, not just September, that supports our Indigenous patients and community. Thanks so much, Monica. So Rob, why don't I turn it to you for final remarks?
Thanks to you, Aaron, for your usual great job in hosting, and thanks to all the presenters today for all the good information that was shared out. To everybody who attended today, it was great to have you along. We are going to revamp the schedule to every month for the fall and onwards. So I think the date for October is to be determined. So maybe just watch out for an invitation to our next town hall in October. Thanks again all for attending, and we'll see you next time.